Well, whether you call it a humanitarian crisis or not, there's no denying that hospitals in Venezuela are facing a chronic shortage of medicine and equipment. Doctors say that nationwide, 80% of medicines are unavailable. Stephen Gibbs has the story from Caracas.
For the children in this cancer ward and their parents, there's little to do but wait. Wait for the medicines that the government keeps promising. Venezuela is cutting all imports by almost 50% this year, and sometimes it seems that nothing is being spared. This nurse told us that here they lack the most basic drugs, including antibiotics. Such shortages are provoking protests, and not just from patients, but from doctors too.
Demonstrations like this are becoming common in hospitals across Venezuela as doctors demand the basics like medicines and equipment so they can do their job.
We don't have water, we don't have gloves, we don't have medicines, and we are so much worried. We need an answer. The government needs to do something to help us.
Earlier, another group of medical staff berated the head of the capital's public health system.
No hay fórmulas.
This doctor asked him to consider the dilemma Venezuelan mothers with HIV are currently facing.
Y las madres, por temor, por supuesto, a que su hijo.
There is no formula milk. The babies cannot take breast milk because there is a risk of infection. So mothers, because they are of course worried, are giving a mix of water and vegetable juice to their babies of just 9 and 10 months. This is the reality today, doctor. This is why we are talking about humanitarian aid, because what we need is humanity and a real will to resolve this problem.
Si nosotros realmente...
His response? That any decision on humanitarian aid was not one for him, but for the leadership of the Venezuelan government.